Welcome to Integrity Linguistics Institute. Let's hear the audio script.
So, are you interested in trying a new way of treating your type 2 diabetes through diet? The diet would involve cutting your calorie intake down to 800 a day.
Oh, that's not many.
Well, it'd mean cutting out fat and sugar and just eating protein and vegetables. But the payoff could be that you'll be completely diabetes-free.
Well, it does sound like a healthy diet, and I guess I ought to have a go if there's a chance of beating the condition. I just hope it's worth the effort, though. I mean, there's no guarantee I won't still have diabetes at the end of it all, is there?
Well, this is a new treatment, but we wouldn't undertake it without some prospect of success.
All right. So now, what's the answer? Is it answer option A, B, or C? I'll give you 5 seconds time, and then I'll play the audio once again. All right. So this is an attitude type question. Okay. There is no doubt regarding that. All right. So very good. So I'll just play the audio once again. All right. And then we will go to the discussion. Just give me a second.
So, are you interested in trying a new way of treating your type 2 diabetes through diet? The diet would involve cutting your calorie intake down to 800 a day.
Oh, that's not many.
Well, it'd mean cutting out fat and sugar and just eating protein and vegetables. But the payoff could be that you'll be completely diabetes-free.
Well, it does sound like a healthy diet, and I guess I ought to have a go if there's a chance of beating the condition. I just hope it's worth the effort, though. I mean, there's no guarantee I won't still have diabetes at the end of it all, is there?
Well, this is a new treatment, but we wouldn't undertake it without some prospect of success.
All right. So now, let's read the question, right? So let's read the question. You hear a dietitian talking to a patient about a new treatment plan for diabetes. So what is the condition of the patient? The patient is a diabetic patient. Okay, so we know it's a diabetic patient. So conversation between a diabetic patient and a dietitian. And what is the topic over here? A new treatment plan for overcoming diabetes. Now, what is the question asking you? The question is asking you, how does the patient react to the plan? Okay, so the doctor is saying this plan to the patient, and presently, what is the reaction? What is the attitude, okay, to the proposed treatment plan over here? Now, we have first answer option as, okay, so before we go to it, how about I ask you this very simple question? So we have a lot of its over here. So what does the word it refer to? Type your answer in the chat box. She's unsure whether she could manage it. She wonders how effective it would be. She is keen to give it a try. What does the word it refer to over here? Yes, very good, right? No, not diabetes. It is going to be, yeah, the diet. Okay, diet or the treatment plan. Okay, very good. Okay, so here the it is not referring to the condition of the patient. Okay, because the patient already knows that she is a diabetic patient. Okay, so here the dietitian is giving a treatment plan. Okay, and your duty is to find how the patient is reacting to the treatment plan, not to the diabetes, right? So the word it over here is referring to the treatment plan. Okay, so how is she reacting? She is unsure whether she could manage it. She wonders how effective it could be. That is the treatment plan. And she is keen to give the treatment plan a try. Okay, so the it is referring to the treatment plan. Okay, good job. Now let's see what are the answer options over here. Now, the first answer option is she is unsure, okay, whether she could manage it. Okay, now what is the tone over here? What is the emotional tone over here? Unsure. Unsure basically means what? Okay, unsure basically means she is not certain. She is doubtful. Okay, she is doubtful. Okay, she don't know. So I'm unsure whether it will rain today. Okay, I'm unsure if this politician will win the election. Okay, that means I don't know. Okay, there is a 50-50 chance. Okay, that's what we call as unsure. So that is the emotional tone over here. Okay, so see, and regarding what? So now you have to make the connection. Regarding what is she unsure about the management, whether she could manage it. Okay, that is, if she is going to start this treatment plan, is she going to manage it? Because it is not just for 1 or 2 days, right? A treatment plan for diabetes, usually it is lifelong. Okay, she cannot simply eat a diet for just 2-3 days and then go back to eating ice cream. Okay, it is a lifelong. Okay, so now she is saying, okay, that is a very good idea, but I don't know if I will be able to manage it. Okay, so that's what she's saying. I don't know. She is unsure. Okay, so what is the emotional tone over here? A lack of certainty. Okay, so she will speak, okay, I don't know, I'm not sure. Okay, that is the kind of tone in which they will be speaking. Okay, again, you have to understand this is an attitude type question. Now let's come to answer option B. The keyword is she wonders how effective it would be. Okay, it once again is referring to the treatment plan. Now see, what is the tone over here? What is the emotional tone over here? She wonders. Okay, wonders basically means she is thinking. Okay, I wonder if going to Kashmir in the month of December is a good idea. Okay, I wonder if I should take fasting for 2 days. I wonder if I should start running every day at 6 a.m. Means she is thinking. Okay, I wonder if this person is a good person. That's what she calls as she wonders. Okay, that means she is thinking. Okay, so that's what contemplation we say. Okay, so the emotional tone is contemplation or thinking. She wonders how effective it would be. Okay, so once again, it is referring to the future tense. That is, if she is going to start this treatment plan, she is basically um, asking whether it is going to be effective or not. She is not believing it. She is not believing that this will be effective. She is not believing that this is going to be 100% success. She is still thinking. She is still thinking whether it will be successful or not. So that is the emotional tone. Okay. So here she will be speaking as if she is doubtful. Okay. She is doubtful regarding its effectiveness. Okay. And then what is the third answer option? She is keen to give it a try. She is keen means she is excited. Okay. That's what. Okay. Keen means very, very excited, means impatient. Okay. That is, she is ready to jump right now itself. Okay. That is, she is a very impatient of it. She is keen to give it a try. So what is the emotional tone over here? Excitement. Okay. The tone will be super, super excitement. She will say, yes, yes, today itself I want to start. Okay. She will be speaking in that kind of tone. Okay. So this is how you have to, prepare yourself during the preparation phase. Okay, so we have a new treatment plan that has been recommended for the patient. And the first question is, she is unsure whether she will be able to manage it. Okay, that is whether she is going to be able to handle it. She is not sure. Okay, she is doubtful. She is doubting herself. She is not doubting. Okay, so here in answer option A, she is doubting herself. Okay, that is she is doubting herself. Okay, I'm not sure if I'll be able to drive a four-wheeler, okay, which has no automatic gear. Okay, I'm trying to, okay, she is doubting herself. But over here also she is doubting. But here, what is she doubting? She is doubting the treatment plan. Okay, in answer option B also she is doubting. Okay, but she's not doubting herself. She is doubting the treatment plan. I wonder if it is going to be effective. I don't think so. Okay, so that is the emotion over here. That is the emotional tone coming. And here she is excited. So what's the emotional tone over here? Here she is super excited. Okay, she is super excited to start the treatment plan. Right. So like this, we have to, again, it may take some time. Okay. But on your examination day, you should be able to catch everything like this very, very quickly. All right. There are no shortcuts over here, especially when we're dealing with Cambridge University materials. Right. So now comprehension. So every one of you here already know what comprehension is. Comprehension is understanding the question. And without understanding the question, there is no point in listening to the audio. So you have to put some extra effort over here. And then it is retention. Retention means registering the information to your mind. Okay, you have to register the information into your mind. Okay, so when the audio is playing, where is your eyesight going to be? Your eyesight should only be in the answer options. When the audio is playing, your eyesight should not go into the question. The memory of the question should be there. Dietitian talking about a treatment plan for diabetes. The duty is to find the attitude of the patient. Okay, and you have to give more importance to the patient. So here, another tip I will give you. You're hearing the voice of a dietitian and hearing the voice of a patient. From whom the answer is coming? The answer is only coming from the patient, because the question is asking you, how does the patient react? So that means you don't have to give much importance to the dietitian. The dietitian is not very important here. The patient is the person who is more important. So you should give more importance to the patient's voice. Right. So now let's take a look into the audio script over here. All right. So the dietitian is saying, so are you interested in trying a new way of treating your type 2 diabetes through diet? The diet will involve cutting your calorie intake to 800 calories per day. Okay, cutting means reducing. Okay. Now she is saying, oh, that's not many. All right. Now she is saying, yeah, that's not many. That means that is not too much of calories. Okay, that she's saying. So what to be sense from here? Say, for example, if I'm telling you, you need to work for 5 hours per day. So you are a patient, you are a person who can work 12 hours per day, but I am telling you from tomorrow onwards, you have to work only for 5 hours per day. So what will you say? Oh, that's not many. I can easily manage it. I can easily manage 5 hours. Okay. Yeah. So that is the emotion over here. Okay. So anyway, let's come to the next part of the audio script over here. Now the patient is telling, no, the dietitian is telling, well, it would mean cutting out fat and sugar and just eating protein and vegetables. But the payoff could be that you will be completely diabetes free. So what is the dietitian assuring? The dietitian is assuring that you will be completely diabetes free. That is 100% you will be completely diabetes free. Right. Now here, the patient, again, you have to focus more on what the patient is saying. Now, what is the patient saying? Well, it does sound like a healthy diet. Okay, now she's saying, yeah, it sounds okay. This treatment plan over here, it does sound like a healthy diet. And I guess I ought to have a go. Okay, that means I guess. Okay, she's saying, okay, I guess I need to give it a try. If there is a chance of beating the condition means overcoming diabetes. Okay, that is beating the condition basically means overcoming diabetes, that is becoming completely healed. Now here is where the answer is located. Now here she is saying, I just hope it's worth the effort though. Okay, now she is saying, okay, I'm willing to put in the effort. Okay, I am willing. I know that you're telling this for my benefit. I know that this is a healthy diet. Okay, and you're telling me that I will become completely diabetes free. Okay, but now she's saying, I just hope it's worth the effort. That is, I'm putting in a lot of effort, but I just hope it is going to be worth it. I mean, there is no guarantee I won't still have diabetes at the end of it, is there? Now, what is she telling over here? She's telling, okay, I'm willing to put in the effort, but I'm not really sure if the effort is going to be worth it. Okay, and she's saying there is no guarantee that I won't still have diabetes. Okay, now what are we sensing from here? She is basically doubting the treatment plan. Okay, so answer option B is she wonders how effective it could be. Okay, so what was the emotional tone that we discussed? She is doubting the treatment plan. Okay, see, if a person is doubting the treatment plan, that is when they will say, oh, I'm putting a lot of effort. I just hope it's worth the effort. I mean, there is no guarantee that at the end of this treatment plan that I will be completely diabetes free. So that means she is a little bit reluctant because she is not completely believing how effective this thing is going to be. Okay, and now the dietitian is saying, well, this is a new treatment, but we wouldn't undertake it without some prospect of success. So here the dietitian is saying it's a new treatment and it has been successful. Right. So what is the answer going to be? The answer is going to be answer option B. Okay, because B is what the audio is telling us. She wonders how effective the treatment plan could be. Now, see over here, she is unsure whether she is she could manage it. So yeah, that doubt part is there. She's unsure means she's doubting. But what is she doubting? Whether she will be able to manage it. That means she is believing that this is a very good treatment plan, but she is doubting herself. Oh, I have very less willpower. Okay, or my situation is not very ideal. So I don't think I'll be able to manage this in the long run. Okay, so that is what answer option A is telling. So are we able to get that kind of an emotional tone from the speaker? Okay, she's unsure whether she is going to manage it. She's doubting herself. So that is not what we get from the audio. But what do we get from the audio? She is doubting, that she is thinking how effective this would be, how effective the treatment plan would be. Okay, she is doubting the treatment plan. Okay, so this is the emotional reaction the patient is having to the new treatment plan that has been suggested to her. So you will be able to choose answer option B as the correct answer. And what is the easiest answer option to eliminate? She is keen to give it a try. So that is, so keen means she is very, very excited. So are we getting that emotional tone that she is very excited to give it a try? No, right? So we are not getting that. So C is very, very easy to eliminate. C should be definitely eliminated. You can either get confused between A or B. Okay, so those who chose the answer option A, I won't blame you because that is also a doubting part is there, but you have to give importance to the keyword, that is she is not able to manage it. So it is answer option B. So again, so I'll just play the audio once again, read the question, okay, and listen to the audio just once again, right? So let me just take the audio once. Just give me a second. All right, so just everyone read the question. Yeah. Okay, so I'll give you 15 seconds time to read the question. Now let's hear the audio script.
So, are you interested in trying a new way of treating your type 2 diabetes through diet? The diet would involve cutting your calorie intake down to 800 a day.
Oh, that's not many.
Well, it'd mean cutting out fat and sugar and just eating protein and vegetables. But the payoff could be that you'll be completely diabetes-free.
Well, it does sound like a healthy diet, and I guess I ought to have a go if there's a chance of beating the condition. I just hope it's worth the effort, though. I mean, there's no guarantee I won't still have diabetes at the end of it all, is there?
Well, this is a new treatment, but we wouldn't undertake it without some prospect of success.
All right. So now, so that is the answer to this particular question. So I have prepared a document over here. So let's just have a quick look into the document and then we will go to the next question. All right, so who do we have over here? We have Dr. Abib, we have Dr. Lakshmi. All right, so thank you for logging, everyone. All right, so this is the question. So I'll be sending this document to you. So this is Daniel Lemming's question number 27. All right, so the answer option is B. Okay, so what type of question is this? So always know what question type you're dealing with. So this is an attitude or feeling based question. So your entire focus should be on identifying the feeling of the person. Okay, the attitude. So answer option A, answer option B, answer option C are all feelings. Okay, so she is wondering how effective the treatment is going to be. Okay, so why does this belong to this particular category? Because the question is asking the emotional response or mental, stance she's having to the proposed treatment. Okay, so all these kind of things. And there are certain strategies over here. The strategy is to focus on the tone. Okay, so that is you really have to focus on the tone, not the language over here. Okay, and then you have to bring in the elimination strategy. All right, so emotional contrast and all will be there. So again, I have prepared a very detailed document and I'll be sending this to you and you will be able to study. So emotional nuance, we say. Nuance basically means, so how do I put it? Like there is a lot of, so there is this one word called ambiguous. Okay, ambiguous basically means not certain. Okay, like 50-50 chance. Okay, that is what we call as ambiguous. Okay, so emotional nuance. Okay, emotional nuance basically means like very small hints. Okay, very small hints of that is giving clues about the emotion of a person. Okay, so that's what that actually means. And here there is a vocabulary builder, because you will not be expecting the same words from the question as well as the answer, or or the audio script. So here I have prepared a vocabulary list as well, with the advanced vocabulary, the synonyms, as well as what it means. Okay, so you can all go through it after the end of the session. All right, so now let's go to the next question over here. This one, right? So this is an attitude type question or feeling type question. Now we are going to discuss a different type of question. So what type of question is this? Read the 20th question. So this is a action. Okay, this is a next step type of question. Right, so everyone read the question. I'll give you 15 seconds time. And then I'll play the audio. And then I will give you the training. Right, so we have the detailed lectures over there. So Dr. Abib, I have given you access to the app. So if you open the app, you will be able to go through the recorded lectures. I have given you access to it. All right, so we have the audio script. Okay. All right, so read the question. Okay, so let's play the audio. Audio script.
You mentioned the risk of patients developing venous thromboembolism. What exactly should I be looking for?
I think it's very important to be aware of the guidelines, but to remember that in practice, diagnosis is complicated. Swollen legs are a typical sign, but patients may or may not present with that, or the swelling may be difficult to detect if the patient is either obese or very thin. Maybe the patient has calf pain or is breathless but doesn't have any other symptoms. If you're at all suspicious of VTE in a patient, refer them urgently for investigation. Actually, though, most cases of hospital-associated thrombosis occur after discharge. We should ensure there's a regular clotting profile so that appropriate preventative or therapeutic interventions can be made, and organize any prescriptions they'll need on discharge.
All right. Now, in simpler terms, so this is actually a very, advanced level question. Okay, so I will play the audio once again. Listen very carefully, and then we'll have a discussion.
You mentioned the risk of patients developing venous thromboembolism. What exactly should I be looking for?
I think it's very important to be aware of the guidelines, but to remember that in practice, diagnosis is complicated. Swollen legs are a typical sign, but patients may or may not present with that, or the swelling may be difficult to detect if the patient is either obese or very thin. Maybe the patient has calf pain or is breathless but doesn't have any other symptoms. If you're at all suspicious of VTE in a patient, refer them urgently for investigation. Actually, though, most cases of hospital-associated thrombosis occur after discharge. We should ensure there's a regular clotting profile so that appropriate preventative or therapeutic interventions can be made, and organize any prescriptions they'll need on discharge.
All right. So what's going to be the answer? Is it answer option A? Is it answer option B? Or is it going to be answer option C? It's a tough question. It's not an easy one. But there are some easy loopholes that will help you to eliminate few incorrect answer options. That elimination strategy, as well as understanding certain keywords in the question, is definitely going to help you out. So what type of question is this? This is a action type question, future plan. Okay, next step. The answer is going to be in the future. So let's understand the question. Now, this is why comprehension of the question is extremely important. Okay, so here in this particular question, I'll tell you why understanding the question is even more important than listening to the audio. Because if you don't understand the question, or if you don't give importance to very two small words in the question, it is going to be slightly tough. So comprehension, retention, and then comes detection, right? So comprehension basically means what? Comprehension is basically understanding the question, okay? Doing the keyword analysis, okay? Keyword analysis, you need to understand what the question is asking you. And once you have understood the question, you have to register that information to your memory, okay? You should not forget what you understood, okay? And with a very strong focus, you need to listen to the audio, right? And then you need to detect the answer. So let's comprehend the question. And here in this particular question, that is extremely important, right? So let's take a look into the question. Answer option, let's read the question over here. You hear a senior nurse, okay? A senior nurse advising a trainee. Okay, so what is the action over here? Okay, the action over here is advising. Okay, senior nurse is advising a trainee, okay, about a condition called venous thromboembolism. Now, the question is asking you, she stresses that the trainee should. Okay, so here, these are the two words that you definitely need to give more importance to. Trainee. Now, see, what is the word over here? She stresses. Stresses basically means what? She is emphasizing. Okay, she is emphasizing, that is, she is putting a lot of significance into that message. It is not a casual message. So for example, if it is a casual message, she will just simply say it, but here she is stressing on it. Okay, she is giving extra importance to it. That is, so there's a lot of emphasis into it. Okay, and regarding what is the emphasis, that the trainee should, okay, that is, this is an advice that should be given to the trainee. Right. So let's take a look into the question over here. Okay. So there is a lot of emphasis given by the senior nurse to the trainee. Okay. So the trainee should do. Should basically means what? Should basically means compulsory. Okay. So it is compulsory. It is mandatory. Okay. So this has to be done by the trainee. So here answer option A, B, and C. Okay. What are these answer options? These are all things, these are all activities that should be done by the trainee. Okay, so I'll just type it over here. All three are possible. All three are possible instructions that the trainee must do. Who should do? The trainee must do, not anyone else. Okay, so this is why it is very important. The trainee must be the person who must be doing this, not anyone else. Okay, so all these are specifically related to the trainee, which should be done compulsorily. And here she is not saying it very casually. She is putting a lot of stress into it. Okay, and this is how you have to prepare yourself for the audio. So we have a topic, venous thromboembolism. Senior nurse is advising the trainee. And what is your duty here? Your duty is to find, what advice has been emphasized that the trainee must do, not anyone else. The trainee. Okay, this is the person who should be doing this activity, not anyone else, right? So let's see what is answer option A. So what must the trainee do? So you have to make the connection, okay? The trainee must pay special attention to identifying the symptoms, okay? So the trainee must give very close attention to identification of the symptoms of venous thromboembolism. So this is the advice that the senior nurse is giving to the trainee, and the trainee must do this. The trainee must pay special attention to identifying symptoms of with this venous thromboembolism. Answer option B, the trainee must ask for help immediately. Okay, ask for help immediately whenever there are any concerns. So if there is any kind of a concern, okay, any kind of a concern, the trainee must immediately ask for help. Okay, that is, he should go to a second party, he should go to a third party, he should report. Okay, he should report, and he must inform this particular concern to other departments or authorities. Okay, this is what the trainee must do. Okay, so you have to always connect the answer option to the trainee. Okay, trainee must do this. Now what is the answer option C telling? The trainee must, okay, the trainee must follow standard treatment procedure whenever possible. Okay, so whenever possible, the standard, okay, so there is a textbook standard over there, and that standard treatment must be followed whenever possible. Right, so this is what we'd call as the keyword analysis. Now let's just do the verb analysis. Okay, let's identify the verbs over here, that is the actions over here, so that it becomes easy for you to eliminate the incorrect answer options. Okay, so here, what is your duty? Your duty is to find what the trainee must do in the future. Okay, the trainee must do in the future if when they're dealing with a venous thromboembolism. This is your duty, right? So what is the verb over here? Pay special attention to identifying the symptoms. Okay, so we can say attention to identifying. Okay, so here the trainee must pay special attention to identification of the symptoms. What is answer option B? Ask for help immediately when there are any concerns. So what is the action over here? What is the verb over here? Ask. Ask for help immediately. That is, without wasting any time, the trainee must ask for help. Right? Now, what is the action, or that is, what is the verb in answer option C? Follow the standard treatment procedure. Okay, so follow. Okay, follow the treatment, standard treatment procedure. Okay, that is what the action over here is. Now you see, now we have three very distinct information. The trainee must pay attention to identification of symptoms. The trainee must ask for help, and the trainee must follow the standard treatment procedure. Okay, so we have, so now this everything should be in your memory. Okay, everything should be registered in your memory. Okay, and now when the audio is playing, your eyesight should only be in the answer options. It should be either in A, B, or C. The memory of the question should be there. Okay, this is a action future type question. My duty is to find what instruction has been emphasized or stressed that the trainee must do. Is it paying attention to identification of symptoms? Is it asking for help? Or is it following the treatment plan? Right. So this should be in the back of your mind. And then you need to listen to the question or listen to the audio and identify what the trainee must do in the future. Right. So let's take a look into the, what do you call it? Yeah, the transcript. Right. So here we have the transcript. You mentioned, so the trainee is asking, you mentioned the risk of patients developing venous thromboembolism. What exactly should I be looking for? Okay, so we know the answer is coming from whom? Is the answer coming from the senior nurse, or is the answer coming from the trainee here? The answer is coming from the senior nurse, right? Because the senior nurse is the person who is advising the trainee, okay, telling what the trainee should do. So the answer is only coming from the senior nurse. So the trainee is asking, okay, what should I do? Okay, what should I do when I'm dealing with a venous thromboembolism case? Okay, now she is saying, I think it's very important to be aware of the guidelines. Okay, but to remember that in practice, diagnosis is complicated. Now, you see over here, they're beginning right away with the guidelines. Okay, here they're saying it is very important to be aware of the guidelines, but to remember that in practice, diagnosis is complicated. Right. So here your eyesight, I mean your the very first answer option should be, I mean your eyesight should be coming to answer option C, because what is answer option C telling us? Follow follow the standard treatment procedure whenever possible. Okay, that is whenever possible, you have to stick to the standard treatment procedure. There is a textbook. Okay, so we call the gold standard, right? So there is a textbook. In that textbook, there is a standard treatment plan, and you have to, whenever possible, you have to always and always follow the standard treatment procedure. But what is the person telling over here? Is now she is saying it is very important to be aware of the guidelines. That is, guidelines basically means what? Guidelines basically means is another word for this one, standard treatment procedure, right? So this is a synonym. Okay, this is a synonym. Standard treatment procedure and basically guidelines are basically the same, right? So now let's go back to the audio script over here. Now she's saying it is very important to be aware of the guidelines. So she's saying, yes, guidelines are very important. But now what is she saying? But to remember that in practice, okay, in practice, diagnosis is complicated. So that means in theory, okay, guidelines basically means in theory, okay, theoretically we have a lot of guidelines, but when you are actually interacting with a patient, when you're actively interacting with a patient, diagnosing a patient is very, very complicated. Okay, so therefore, you cannot always depend upon the guidelines. Okay, are you getting the message? Okay, the message is, okay, it is very important to be aware of the guidelines, but remember that in practice, diagnosis is very complicated. Okay, so here, what is the hint over here? The hint over here is do not follow the standard treatment plan whenever possible, because diagnosing is a very, very complicated situation. Okay, and therefore you should not, we have to use our intelligence. We have to use our intelligence. And sometimes if it's a complicated situation, you should not follow the treatment procedure. You should be aware of the guidelines. You should be aware of the treatment procedure. Okay, but remember that this is a very complicated issue. So you should not always and always depend on it. Okay, so we can say that it is not going to be answer option C. Okay, so that is, if you're very, very thorough on this, as soon as you hear the very first sentence itself, you can eliminate answer option C. Follow the standard treatment procedure whenever possible. Now see, the question over this trainee should basically means what? Compulsorily. Okay, must. That is, no matter what happens, even if the hospital is on fire, even if the patient is saying this, even if the whole world is saying this, you must always possibly follow the standard treatment plan. Okay, that is what answer option C is telling. But in the audio script, what is the message? She is saying guidelines are important, but diagnosis is complicated. So it is not. So you must be able to sense it. Okay, so now anyway, let's come to the second sentence. Swollen legs are a typical sign. Okay, now she is telling about swollen legs are a typical sign. Now that is what? That is symptoms. Now from answer option C, you should be able to go to answer option A, because what is answer option A over here? The A over here is symptoms, identifying the symptoms. And here the trainee must pay special attention to identification of symptoms, right? So let's see. So she is talking about the symptoms. She's saying swollen signs are a typical sign, but patients may or may not present with that, or the swelling may be difficult to detect if the patient is either very obese or very thin. So she is telling about the typical symptoms of this particular disease. Okay, that is swollen legs. Swollen legs are a very typical sign, and patients may or may not present with it. So sometimes they may have swollen legs, they may not have swollen legs, or the swelling may be very difficult to detect if the patient is either very obese or thin. So if the patient is very obese or the patient is very thin, detecting or identifying. Now see, detection is what? It's another synonym for identifying. Okay, it means she is saying identifying this or detecting this is going to be very difficult. So they're talking about answer option A. Okay, but here what is the instruction? In the future, the trainee must pay special attention to identifying these symptoms. But here they're telling this is a symptom of this, but it is not always very easy to detect if the patient is obese or very thin. Okay, so anyway, let's just keep reading. Maybe the patient has calf pain or is breathless but does not have any other symptoms. Now here also we are talking about several other symptoms, right? So we are still in answer option A. Swollen legs is one symptom, calf pain is second symptom, or breathlessness is the third symptom. Okay, so here we know they are talking about answer option A, because answer option A is pay special attention to identifying the symptoms. So here they're talking about the symptoms, but what is the verb over here? The verb over here is paying special attention. So you must wait for it. Okay, is the senior nurse telling the trainee that you have to pay very close attention to symptom identification? So here they have mentioned the symptoms. Swollen legs, symptom number 1. Calf pain, symptom number 2. Breathlessness, symptom number 3. But doesn't have any other symptoms. Right. So here this part is missing. That is, paying special attention is basically missing. Okay, so we understand that. All right, so now let's go to the next part of the sentence, audio script. Now she is saying, if you're at all suspicious of VTE. Now see over here. Now see, this is what I wanted to tell. Now see here, what is the word here? If you are. Now this is why I told you understanding the question is very important, because here the question is asking what the trainee must do. Okay, the senior nurse is instructing the trainee and your duty is to find what the trainee must do, right? So here you see the senior nurse is specifically telling, okay, she's pointing her finger and telling, if you, okay, so that is what we need, okay, as the what the trainee must do. So here she is telling, if you are suspicious of VTE, so when you're dealing with a patient and if you are suspecting that it is a venous thromboembolism, refer them. Okay, so what is the person telling? If you suspect that it is a VTE, you have to immediately, urgently, okay, urgently refer them. So what is the synonym for urgently? Immediately, right? Immediately is another word for urgently. And ask for help. What is another word for ask for help? Ask for help is refer, right? And what is the, keyword over here? If you are. So here she is giving special instruction to the trainee. If you suspect that is a VTE, you have to ask for help immediately. That is, you have to refer the patient urgently. Right. So that is what she's saying. Okay. So these are the keywords over here. Okay. It's a tough question, but you have to train yourself. You have to train yourself to, to like recognize these symptoms over here. If you're still suspicious of VTE in a patient, refer them urgently for investigation. All right. Actually, though, most cases of hospital-associated thrombosis occur after discharge. Now, she is saying, now this and all is not very important. This is just a distractor over here. Okay, in most cases, it happens after discharge. Okay, again, this is just a distractor. We should ensure. Now, see, what is the word over here? We. Okay, we means what? We means all of us. Now, see, this is the difference between we and you. Your duty is to find what the trainee must do. Okay, so this is more important to us. Okay, this is more important to us than we. Okay, so this is where you have to become more alert. Now, see, we basically means not the trainee. It is everyone. So this information is not what we are looking for. Okay, so here she is telling we should ensure that there's a regular clotting profile so that appropriate preventative or therapeutic interventions can be made and organizing any prescriptions that will need on us in discharge. Now you see over here, this entire portion from here to here. Okay, so this entire portion are what we call as distractors, because it has nothing to do with the answer options. Okay, it has nothing to do with the answer option. It is just telling after discharge what happens and what everyone should do. Okay, the question is asking what the trainee must do. And it is basically in this part of the sentence where they have specifically mentioned what the trainee must do. If you, okay, this is the special instruction. If you suspect that it is a VTE, then you should not wait. Urgently, you need to refer them to an investigation, right? So what is the answer going to be? The answer is going to be answer option B, right? Because B is telling ask for help. Now you see, this is the word ask. That's the key word over here that is mentioned. Help immediately, that is mentioned. Every single verb is mentioned. So you can choose answer option B. And this is what the trainee must do, not anyone else. Right. Now see over here, they have talked about the symptoms and they have talked about the identification of the symptoms also. But what is the verb over here? the verb over here is pay close attention to the symptoms. That is not mentioned. That is, you have to. So as soon as you suspect that you have a patient who's suffering from venous thrombosis, you have to pay very, very close attention to the identification of symptoms. That is not really emphasized. Again, you have to focus that this is the keyword of your stress. Okay, the stress is not regarding the paying special attention. So we cannot choose answer option A. And in the very beginning, we eliminated answer option C because he is telling follow the guidelines. Okay, any chance you get, you have to follow the guidelines. But what is the answer option? What is the audio telling? It is a very complicated process. Following the guideline is a very complicated process. So, no, diagnosis is a very complicated process. So that means there is a flexibility. There is a flexibility. There is no need to always follow the guidelines. Just be aware. Okay, just be aware of the conditions over there. Right. So this is a tough question. The answer option is going to be B. Right. So I'll just play the audio once again and read the question, understand the question. Okay. Give importance to these two words. She's stressing. Okay. So you have to focus on what future plan, that is what action the trainee must do. Okay. And she is emphasizing. Okay. And you have to give importance to what she's telling to the trainee, not to anyone else. Okay. So when you hear the word you have to become alert. That is why I told you comprehension of the question is very, very important over here. So first, they will begin with answer option C. Okay, you will be able to track the order like this. First, they will talk about answer option C. Then they will talk about answer option A. And then finally, they will talk about answer option B. Okay, and then they'll be talking a lot of useless information that is completely not related to the answer option. It is what we call as distractors. Right, so it is C, A, B. All right, so I'm going to play the audio once again. And this time you pay very close attention to the audio. Right. So let's just take the audio once again. So we have like very detailed. So I'll just show you the lectures. I mean, the slides over here. So in slides and all, as you can see, B is the correct. So it's been color coded in the app. And there is a very detailed explanation. Okay. Like why B is the answer. And also there is a detailed explanation like why A is the, incorrect answer option. And also in Indian languages also, like I have made the translations. Okay. So that it is easy for those who prefer to understand the information in their native language. All right. So right. So let's just take the audio script once again. Okay. Read the question. Okay. Play the audio now.
You mentioned the risk of patients developing venous thromboembolism. What exactly should I be looking for?
I think it's very important to be aware of the guidelines, but to remember that in practice, diagnosis is complicated. Swollen legs are a typical sign when patients may or may not present with that, or the swelling may be difficult to detect if the patient is either obese or very thin. Maybe the patient has calf pain or is breathless but doesn't have any other symptoms. If you're at all suspicious of VTE in a patient, refer them urgently for investigation. Actually, though, most cases of hospital-associated thrombosis occur after discharge. We should ensure there's a regular clotting profile so that appropriate preventative or therapeutic interventions can be made, and organize any prescriptions they'll need on discharge.
All right. Now, okay. So again, it's a tough question, not an easy one. I think I would say it is one of the, it's a slightly, not a slightly, it's a quite challenging question compared to the previous one. So here also, like I have prepared a document. I'll be like sharing this document to you towards the end of the session. And there are like a lot of important information over here. So it begins with the question type. Okay, so this is an action type question or a next type question. So what is your duty? Duty is to identify what the trainee must do in the future. You see, the question is asking what the trainee is expected to do, okay, when faced with a patient who is suspected to be suffering from this particular thing. Now, see, it focuses on a recommended action. That is what the trainee must do compulsorily, mandatorily, this person has to do it, okay, and this direction is given only to the trainee, only to anyone else, okay. Now, see the word, she stresses. She stresses basically means what? It signals. See, every single word in OET question paper has a purpose. Okay, it signals an instructional emphasis. Okay, that means it is extremely important. Okay, it is an instruction over here, and she is emphasizing on it. A clue that the speaker is guiding a behavior. Okay, so how do you approach these type of questions? Again, listen for verbs. Okay, so in the answer options also, like the verbs are extremely important. Okay, and the verbs like, refer. Okay, see, these are all action. Okay, action verbs, right? Because your duty is to find what the person is supposed to do. Okay, so the nursery, you must refer, you must organize, you must ensure, you must follow. So these are what we call as action verbs. You must report. Okay, so you have to train yourself. Okay, my duty is to find the action over here, so let me listen to action verbs. Okay, so like this, and see, urgency cues as well, because it's a trainee. Okay, and she's stressing. Okay, no, she's stressing, she's emphasizing. So that means there is a sense of urgency. Okay, so yeah, so there's a sense of urgency. So like words such as immediately, urgently. Okay, so these all indicate urgency over here. Right. And then you have to bring in the elimination technique. That is extremely important. You should be able to eliminate. So here elimination strategy is slightly difficult, but still you must be able to rule out. Rule out basically means eliminate options one by one. Okay. So all that things. And then we have a vocabulary builder over here. So there is a lot of, advanced vocabulary over here. So I have made a list of those vocabulary. I have made a list of those synonyms, and I have made a list of the meaning as well. Okay, so those who want to, prepare a little bit more in depth, you can go through these documents, make some notes. Okay, so that is what the 28th question is all about. All right, so that's the main message for today. So when it comes to OET listening part B, we have 9 different types of questions. So in yesterday's session, we discussed about what are main concern type questions and problem solution questions, right? In today's session, we discussed about attitude or feeling questions, as well as action and next step questions. Okay, so if it's an attitude type question, you have to focus on the emotional tone. Okay, the tone in which the speaker is speaking. If it is a next step type question, then you have to focus on the future. So the action verbs. Okay, action verbs, right? So these are certain words. These are certain words that will, give you some clues into it, right? And then there are different types of questions as well. Detail specific questions, opinion type questions, purpose type questions, role clarification. These are a little bit rare. That's it. So that is about the this particular session.